Thank you for giving me the opportunity to speak today about heart disease, particularly how it affects the Asian Indian community. I also want to acknowledge the wonderful work that's being done for our community by the PIC5K group. You know, when we look at heart disease, one way to start this is to look at some startling maps. If you look at all nations across the world, there's an incredibly wide variation in how prevalent or common these illnesses are. That's not surprising, of course. One way to look at it is to focus on non-communicable diseases. These are the diseases such as heart disease and cancer and respiratory diseases and diabetes. What you see in this map is that the probability of dying from one of these four conditions is actually quite high in India. In fact, over 25% of deaths can be attributed to one of these conditions. Now, I think we can group diabetes with heart disease because diabetes raises the risk for heart disease so much. India has amongst the highest rates of death related to heart disease. In these kinds of maps, red is typically bad. And you see India as bright red here. For India, there are about 200 deaths for every 100,000 people related to heart disease. In journals and publications, you'll often see Indians grouped into the South Asian community. South Asians essentially refers to individuals whose origin comes from the Indian subcontinent or adjacent countries. In total, they account for about 17% of the global population. So this is a massive number of people. Now, you may wonder whether Indians who have emigrated to the United States, whether they're at similarly elevated risk. When we live in the US, does the risk get better? Does it get closer to that of the heart disease risk within the white population in the United States? As it turns out, the answer is no. The risk is still quite high. The way you interpret this graph here is that any number over 1 is basically implies a higher risk within that community. And so you see that Asian Indian women, as well as Asian Indian men, both have a higher risk for heart disease related mortality or death compared to their white counterparts. Now, it's important when you look at these kinds of data that this is not just an issue of race or ethnicity. There are a whole host of factors that contribute to heart disease, and we're going to go into some of that in the next several minutes. But before I do that, some sobering facts about India and heart disease. 20% of the world population is represented by the Asian Indian community, but they consist of about 60% of the heart disease burden. Heart disease occurs in Indians at an earlier age, almost 33% earlier. 50% of heart attacks in Indian men occur under the age of 50. 25% of heart attacks, amazingly, in Indian men occur under the age of 40. And Indian women, too, have higher rates of heart disease-related adverse outcomes. Now, let me just step back a little bit and talk about the development of heart disease. What is this? What are we actually talking about? When we talk about heart disease, the major aspect that we're referring to is the buildup of plaque within the blood vessels of the heart or through other vessels in the body. That's what you see on the left-hand picture. You see this buildup of plaque, this yellow plaque that's basically obstructing the blood flow to a particular area of the heart muscle. What you see on this video cartoon on the right is this plaque building up over the course of many months to years. And eventually this causes chest pain. It can lead to heart attacks and things like that. But this is a decades-long process. It's thought that actually the initial insult for the development of this kind of plaque actually begins in your 20s. And so at the earlier the age that we can actually start having good health practices, the better it is for all of us downstream when we get older. Now, the previous slide was what happens at kind of a mechanistic level, but this is actually what we see clinically. This is an all too common scenario. This is a 42-year-old Indian male who basically presented with sudden onset of chest pain, had a family history of heart disease, doesn't smoke, high blood pressure was a little elevated, not terrible. The cholesterol values you see here, and he presented with a heart attack. He was taken emergently to the cath lab, and this is what we do. We basically take pictures of the heart vessels, and what you see here is a blocked artery, and this should look like a big letter C here, and it doesn't. So there's a blockage right where you see this cutoff in this vessel. And what we end up doing here is basically fixing these things. We basically open the vessel with a balloon and then put a stent in, and that's how we restore the blood flow. But the real issue now is how do you prevent this? How do you prevent these kinds of bad events? Well, there are a number of heart disease risk factors. There's some things that we can't change, of course. There's a family history, and you can't change your gender in a meaningful way to affect heart disease risk. And of course, age, you can't really modify. But there are enough things that we can modify. Your cholesterol, whether you smoke or not, your blood pressure, diabetes, and so on and so forth. And we're going to get into a little bit of this because the real point of this is not the bad news about how high the risk is amongst Indians, but the fact that we can actually do something about this. Now, among Asians, Indians actually have a relatively lower smoking rate compared to other Asian populations. And what we have to be really careful of, though, is that that smoking has changed its face in recent years. Nowadays, there's e-cigarettes and there's the concept of vaping. Some people are under the misguided impression that vaping is somehow safer. It's not. Vaping is just as risky and injures the cells that line our heart just as much as smoking does. And there's a lot of ongoing studies to look at this. But the early studies suggest that vaping and e-cigarettes are not healthy healthy practices. And so this is something that we have to all be careful of, especially in the younger population where I think vaping has become much more prevalent. But let's just simply say that stopping smoking is the #1 preventable risk factor to prevent heart disease and cancer and things like that. And moreover, when you stop smoking, the health benefits are virtually immediate. Now, we could spend hours and hours talking about diet, but we can boil it down to just maybe a few things. First of all, home-cooked meals are always better. We can avoid the processing of food that occurs in restaurants and things like that. We want to increase your vegetable and fruit intake. This has been shown in study after study that increased vegetable and fruit intake will decrease the cardiovascular risk. Okay, so let's make it simple. What can we all do? Well, there's the concept of 5 a day. 2 servings of fruit every day and 3 servings of vegetables every day. Now, let's keep it even simpler. What's a serving? A fistful of fruit or a fistful of vegetables is basically 1 serving. So an apple is 1 serving of fruit. A banana is 1 serving of fruit. So if we can keep these kinds of easy things in our mind, then we can try to, we can really make an impactful change in our risk for heart disease. For carbohydrates, we want to increase the grains and oats. For protein, you want to favor the vegetarian options like soy or tofu or paneer, but of course you have to be careful of the fat content. Nuts are good, not overdoing them, but a handful of nuts every day is actually good. And you want to avoid soft drinks, even diet soft drinks. There's been a number of studies that really show that even diet drinks, soft drinks, are not healthful. In fact, they increase the risk of cardiovascular disease. You can also consider intermittent fasting. I would just advise people to check with their doctors before they do something like this, because there are some people who shouldn't be doing intermittent fasting. There's a lot of different types of intermittent fasting out there, like the 16-8, where you don't eat for 16 hours and you restrict your food intake to 8 hours. So if you eat at 6 p.m. your dinner and then wait until noon the following day, that's essentially that's essentially an 18-hour fast or something like that. So there's other people who do a once weekly fasting, and so I think this intermittent fasting does have some benefit. There's data that suggests that it improves heart function, improves the immune system, and so on and so forth. So something to consider. But again, I would just check with your your doctor before you do things like that to make sure it's safe. Ultimately, though, to put it simply, we all have a choice in every meal that we take in to choose whether we're going to be healthy. So, are we going to choose to be healthy or not so healthy? And so, these are the choices that we have to make, and these kinds of choices make a big difference in terms of our overall cardiovascular risk. Now, being active obviously lowers risk, but obviously not always easy. But the goal here is to try to do 30 minutes of moderate activity at least 5 days per week. Remember that being thin doesn't necessarily mean that you're healthier. In fact, most Indians actually fall into the normal weight range, but they're still at high risk. This was an interesting study that was shown where two Indian men, basically the same weight, but one had a higher body fat content than the other. They're indistinguishable in terms of their body habitus, but the distribution of fat is very different. Anyway, these are just interesting things. I think the real issue is just trying to be smart about how we eat, the choices we make there, and trying to be as active as we can. Here's a thing I think everyone should be doing. If you're an adult, you should actually take ownership of your cardiovascular risk. You can actually do this online. There's apps to do this. You can actually go to this ASCVD risk calculator, and you can just plug in your own numbers, your age, your gender, your race, your blood pressure and cholesterol, and it will give you a number of what your 10-year risk is of having some sort of cardiac event, let's say like a heart attack or a stroke or something like that. And I just put in some made up numbers here, and you see that the risk is about 9.5%. It's recommended that when that risk goes over 7.5%, they really modify things, maybe start some medications and things like that. Now, what about cholesterol? Cholesterol is one of the biggest risk factors for heart disease. Obviously, you want to follow a low cholesterol, low fat diet. There's certain numbers or targets that we all should keep in mind. We should all make sure that our total cholesterol is less than 200. The LDL, or the bad cholesterol, should be less than 100, or the lower the better, frankly. The HDL cholesterol, which is hard to raise, commonly low amongst Indians, ideally should be greater than 40, at least for men, and greater than 50 in women. That's a good prognostic factor. But remember, HDL is actually frequently seen as a low value in Indians for a variety of reasons. The triglycerides we want to keep less than 150. This ApoB and ApoA1 ratio is something that we don't typically check actually in the United States, but actually many studies have suggested that it's an important risk factor in South Asians. Now, importantly, when should you think about starting medications? When might your doctor bring this up? If you have diabetes, you should really be on a medication, because diabetes increases the risk for heart disease. And so getting on a cholesterol medicine is important in that. Certainly if you have a prior history of heart attacks or strokes or coronary disease. Importantly, though, you can actually calculate your risk, right? So in the previous slide, I showed you how you could actually calculate your risk. And if that risk is greater than 7.5%, the recommendation is that you should be on a cholesterol lowering drug, because of that elevated risk. And then this is something to think about, and this is something your doctors can actually talk to you about, is whether you should measure a coronary calcium score. This is more complicated, but this is something that we do quite frequently nowadays to help understand a given individual's risk for having some sort of cardiovascular issue down the road. Now, what about blood pressure? We all measure our blood pressure. This should be checked frequently. Every healthcare visit should actually have a blood pressure check. Controlling blood pressure is incredibly important. It reduces the risk of heart disease by 25%. 120 over 80 is the normal blood pressure. If it goes up a little bit there into this 120 to 129 range, it's still recommended that you don't have to be on medications, but important to keep an eye on it. Once it gets over 130 or 140 for sure, then it's really important to start thinking about medications to help control that, because it's such a risk factor for heart disease and stroke. Diabetes is really a global and a particularly, unfortunately, Indian epidemic. So it's important to get screened for diabetes. Clearly, we can make choices in terms of modifying our diet with lower sugar intake and carbohydrate intake. Exercise decreases the risk of diabetes and helps to control diabetes. And importantly, there are many, many new medications for diabetes today that help to not only treat diabetes, but also decreases the risk of heart disease in someone who may have diabetes. So these are things that your doctors may bring up. Importantly, we follow things like the A1C level, which is a measure of how well your glucose is controlled, blood pressure and cholesterol, which we talked about. So these are things that I think everyone should just be familiar with and aware of. Now, we can also call upon our ancient practices and customs of India to take care of our heart. Yogasana improves breathing. It results in increased focus and the benefits and has benefits in terms of heart disease and improves sleep, improves mood, it improves brain function, and so on and so forth. So there's clearly benefits from this ancient Indian practice. And of course, meditation is another ancient practice of ours that has profound benefits, including reduced blood pressure, improved breathing, improved mood. Did you know actually that those people who practice meditation frequently have a change in the expression of certain genes that actually improves heart function? So this is not actually something that we should ignore and just say, well, these are just ancient practices that were practiced a long time ago and they have no role today. In fact, many scientific journals these days are actually identifying the real benefits of yogasana and meditation upon not just cardiovascular health, but overall health in general. And so there is, I think, an opportunity for us to really take a hold of our lives and integrate the various aspects of our lives. Ultimately, heart health results from the true integration of the various aspects of our lives. At the physical level, we have to stay active. At an emotional level, we have to strive for peace of mind and try to decrease the stress. Easier said than done, but that's important to do. And at an intellectual level, we must practice moderation and make the right choices in the things that we do, not just because we have to or are forced to, but because we understand that these are choices that we make today that will affect us in the future. And so these are actually quotes. Without action, how can we maintain health? How can there be happiness or health for one lacking peace of mind? Health is accomplished by those who regulate diet and recreation, action, sleep, and wakefulness. And you know where all these come from? They actually come from our scriptures, from Bhagavad Gita. This is a teaching that happened 5,000 years ago, and we can actually act on them today in terms of integrating our lives and actually promoting our overall, not just cardiovascular health, but overall health in general. And so I'll just end with, there are things that we can do to take hold of our health. We can assess our risk. We can watch our blood pressure, cholesterol. We can stop smoking if you're smoking. Watch our diet, control the diabetes, exercise, and really find your center. Find your center of balance. And if we do those things, I think we're doing a good job in terms of taking care of ourselves. So thank you again for the opportunity to speak today, and I hope this was helpful. Thank you.